makes a huge difference, just being able to decide on the treatment plan with the information to hand while you're with the client. So for cases that aren't hospitalised, deciding whether to leave antibiotics, deciding on whether you need to do further diagnostics there and then, I think it makes a huge difference, a huge time saving in driving to and from the practice, or in clients having to come and pick drugs up if you subsequently decide you need them. But also really client satisfaction with some longer term cases, them being able to see there and then that you are making progress, and to be able to follow that in a way that they can very easily understand with a number, I think is really helpful. Clients have really taken that on board. Foals, we now run the SAA as a routine along with IgG, and again in the same way you want IgG foal-side, having the SAA foal-side means that you can make decisions about care for that neonate straight away, and our studs expect that now. So I think improving the way we treat our cases really, and some of the more obscure cases giving us additional information to help us know whether we need to do further investigations, or whether we whether we can just monitor a case, and definitely offering something to the clients that they can understand, that they can feel confident if they're not necessarily seeing an improvement in their horse following treatment, that you can show them that yes, there isn't, there's a very obvious improvement in the SAA, then they can be reassured by that, and just making sure that we're treating cases appropriately really, especially with where antibiotics are concerned. So I'll usually take a range of blood tubes from the horse or foal, and run the SAA there and then to decide whether to come back to practice and run the haematology, biochemistry, etc. We have a lab at the clinic, so then obviously if the Stablelab flags up a problem, then we can come back to the clinic. We might run haematology there and a biochemistry. If the SAA is normal, we might decide further tests aren't indicated.